my name is Tabitha DiBacco from Western Michigan University, and I'm excited to tell you today about my dissertation titled A Two-Session ACT Intervention with Healthcare Workers During the COVID-19 Pandemic. 2.9 million. That's the estimated number of US healthcare workers who thought about suicide during the COVID-19 pandemic. In the study I'm going to talk with you about today, 20% of our participants thought about suicide. And if you look closely, you can see it in their eyes. The exhaustion, the pain, the burnout. During the past few years, we have all found ourselves impacted by the global spread of COVID-19 in our work and daily living. Initial research showed that our frontline workers were particularly affected, experiencing increased rates of depressive, anxious, and even trauma-related symptoms. We are still feeling the effects of the pandemic. I selected acceptance and commitment therapy, also known as ACT, as the intervention for this study because I think it can provide unique benefits during times of crisis. ACT focuses on ways that we can lead a meaningful life despite the pain that is sometimes inherent in living. We implemented our two-session ACT intervention with a pilot sample of 28 Michigan healthcare workers. Session 1 focused on mindfulness and diffusion. Mindfulness refers to being present with our own experiences. When in times of crisis, we might feel disconnected from our own needs or emotions, or as though we're just going through the motions. Diffusion refers to creating distance between ourselves and painful thoughts that might make it more difficult to engage in valuable action steps. Thoughts such as, the pandemic is never going to end, I'm not enough, or no one cares about the work I do. Session 2 focused on identifying participants' values that might have drawn them to the field of healthcare initially, and then identifying action steps towards pursuing those values. In our pre-post analyses, we found significant decreases in depressive, anxious, trauma-related, and burnout symptoms. These symptoms weren't gone, but they were more manageable, and our participants identified the change as capable of improving quality of life. At the onset of this talk, I told you that 20% of our participants had recently thought about suicide prior to our intervention. In our final week of data collection, that number was 0. The crisis in healthcare is still here. We can and we need to help healthcare workers because that number should always be 0. Thank you.